Just finished a night shift, and during that shift I had a case that reminded me of the recent CDC update regarding the bacterial outbreak in eye drops. Let's talk about it. As of last week, the CDC has identified 55 people who have been infected with this rare strain of this extensively drug-resistant bacteria called Pseudomonas. Although eye infections are one of the main reasons why we know that this problem exists, these patients have also been sampled in terms of their sputum cultures, blood samples, and even urine samples, and isolates of this bacteria have been found in some of these samples as well. It was found that most of these patients have been using some form of artificial tears for dry eyes, and EzraCare artificial tears, which is a preservative-free over-the-counter product, was the most commonly used product. The CDC also did lab testing of open bottles of this EzraCare artificial tears, and they found isolates of this extensively drug-resistant bacteria in these open bottles. Now, the CDC is also testing in bottles that have been pre-packaged and already closed to try to figure out where exactly this bacteria came from. And because of this, the CDC is recommending that patients and healthcare providers immediately stop using EzraCare artificial tears. They've also recommended to immediately stop using Delsa Pharma's artificial tears, which is another preservative-free product that has been found to be associated with this outbreak. Pseudomonas keratitis is a vision-threatening condition that needs immediate recognition and antibiotic treatment. It's actually an infection that's most commonly seen with people who wear their contact lens for prolonged periods of time. Aside from avoiding these products, you can avoid this type of infection by a couple of key steps that you can do in your daily life. Make sure that you keep your eye drops clean, avoid touching the top of the eyedropper, and pay attention to the expiration dates of the eye drops, especially if they're preservative-free. Once it goes past that expiration date, there's an increased risk of contamination. Change your contacts regularly, and also make sure that your makeup products are clean. And then, of course, most importantly, wash your hands before you touch your face. And lastly, if you notice that you have any pain, redness, itching, or discharge from the eye, you have to make sure that you get evaluated as soon as possible. Okay, that's my time.